Top 25 Residency Interview Questions and Answers. In the competitive landscape of residency applications, interviews play a crucial role in determining candidates' futures. This video will guide you through the top 25 questions frequently posed during residency interviews, along with effective answers to help you prepare. Understanding the nuances of these questions can significantly enhance your performance. By familiarizing yourself with common inquiries and expert responses, you'll be better equipped to present your qualifications and experiences confidently during your residency interviews. 1. Why did you choose this specialty? Choosing this specialty stemmed from a deep-rooted passion for patient care and a desire to make a tangible difference in people's lives. Throughout my clinical rotations, I was particularly drawn to the complexity and dynamism of this field. The ability to work collaboratively with a multidisciplinary team to devise comprehensive treatment plans excited me. I appreciated the opportunity to engage deeply with patients, understanding their concerns and guiding them through their healthcare journeys. This specialty aligns with my values of empathy, advocacy, and lifelong learning, making it a perfect fit for my career aspirations. 2. How do you handle difficult or angry patients? Handling difficult or angry patients requires patience and effective communication. I start by actively listening to their concerns without interruption, allowing them to express their feelings. Acknowledging their emotions is crucial, as it helps build rapport and shows that I care. I then calmly explain the situation from a medical perspective, providing clarity on their concerns. If necessary, I offer solutions or alternatives while ensuring they feel heard and respected. My goal is to diffuse tension and foster a collaborative relationship, ultimately leading to better patient satisfaction and outcomes. 3. Can you describe a time when you received critical feedback and how you responded? Receiving critical feedback during my third year of medical school was a pivotal moment for me. I was informed by my attending physician that my approach to patient communication needed improvement, particularly in listening more attentively. Instead of feeling defensive, I took the feedback seriously and requested to observe how experienced clinicians engaged with their patients. I practiced active listening techniques and sought out additional feedback from peers. Over time, I noticed significant improvements in my patient interactions, which reinforced my commitment to continuous personal and professional growth in medicine. 4. What do you consider to be your greatest career accomplishment so far? My greatest career accomplishment thus far has been leading a community health initiative that provided free screenings and health education to underserved populations. This project not only improved access to healthcare but also fostered relationships between local providers and the community. Witnessing patients gain knowledge about their health and make informed decisions was incredibly rewarding. This experience solidified my commitment to addressing healthcare disparities and inspired me to continue advocating for vulnerable populations in my future practice. 5. How do you demonstrate empathy to patients? Empathy is crucial in healthcare as it fosters trust and understanding between patients and providers. I demonstrate empathy by actively listening to patients, ensuring I fully comprehend their concerns and feelings. I make eye contact and use open body language, creating a safe space for them to express themselves. I validate their emotions, acknowledging their experiences without judgment. Additionally, I tailor my communication to fit their needs, providing reassurance and support while educating them about their conditions. This holistic approach helps patients feel valued and cared for during their treatment journey. 6. What research would you like to pursue related to your specialty? I am particularly interested in exploring the intersection of technology and patient care, specifically focusing on telemedicine and its impact on healthcare accessibility. Conducting research that evaluates the efficacy of virtual consultations in managing chronic illnesses could provide valuable insights. Additionally, I aim to investigate patient outcomes associated with remote monitoring devices, assessing how they enhance patient engagement and adherence to treatment plans. This research could help inform best practices and improve health equity across diverse populations. 7. If you disagreed with a colleague about a patient procedure, how would you handle it? In situations of disagreement regarding a patient procedure, I would prioritize open communication. I would first seek to understand my colleague's perspective and the rationale behind their approach. Engaging in a respectful dialogue allows for a clearer understanding of differing opinions. If necessary, I would suggest involving a supervisor or a third party to mediate the discussion, ensuring that we focus on the best interest of the patient. Collaboration and shared decision-making are key to resolving differences constructively while maintaining a professional relationship. 8. Where do you see yourself in 10 years? In 10 years, I envision myself as a skilled specialist, deeply engaged in both patient care and medical education. I aim to hold a leadership position within my institution, where I can mentor young professionals and foster a collaborative environment. Research in my field will be a priority, allowing me to contribute to advancements that improve patient outcomes. I also hope to be active in community outreach, promoting health education and advocating for underserved populations. Balancing clinical practice with teaching and research will be essential to my career fulfillment. 9. How do you earn the trust of a patient who mistrusts the health system? Building trust with a patient who has a deep mistrust of the health system begins with genuine engagement and active listening. I take the time to understand their concerns and experiences, validating their feelings without judgment. Transparency is key. I explain procedures and decisions clearly, ensuring they understand every step. Consistency in my actions and follow-through on promises helps reinforce reliability. Establishing a rapport through empathy and respect allows the patient to feel valued, gradually bridging the gap of mistrust and fostering a therapeutic relationship. 10. What does social justice in medicine mean to you? Social justice in medicine means ensuring equitable access to healthcare for all individuals, regardless of their socioeconomic status, race, or background. It involves recognizing and addressing systemic barriers that lead to health disparities. For me, this means advocating for marginalized communities and working to create policies that promote health equity. It also entails educating myself and my peers about the social determinants of health, fostering an inclusive environment in healthcare settings, and actively participating in initiatives that aim to reduce inequality within the medical field. 11. How will you balance being a leader and being a team player during residency? Balancing leadership and teamwork during residency is essential for providing optimal patient care. I plan to cultivate self-awareness by recognizing when to lead and when to support others. Active listening will be key. I will seek input from my colleagues and value their expertise. Establishing open communication fosters a positive environment where everyone feels empowered. I will encourage collaboration through regular team check-ins, ensuring that all voices are heard. By promoting a culture of respect and mutual support, I believe we can achieve better outcomes for our patients and enhance our learning experiences together. 12. What worries or concerns you most about residency? One of my primary concerns about residency is the potential for burnout. The demanding nature of the training can sometimes lead to exhaustion, both physically and emotionally. I am aware that maintaining a healthy work-life balance is crucial, and I fear that the pressures of residency might interfere with my well-being. Additionally, I worry about the steep learning curve and the responsibility of making critical decisions that can impact patient outcomes. I aim to develop strong coping strategies and seek support from peers and mentors to navigate these challenges effectively. 13. If you could invite anyone, living or deceased, to dinner, who would it be and why? I would invite Dr. Paul Farmer, a renowned physician and humanitarian known for his work in global health and social justice. His commitment to serving marginalized communities and addressing health disparities resonates deeply with my values. I admire his ability to combine medicine with advocacy, and I would love to discuss his experiences in Haiti and other underserved areas. Engaging in a conversation with him would inspire me to explore innovative approaches to healthcare delivery and deepen my understanding of the intersection between medicine and social equity. 14. How do you plan to avoid burnout during residency? To avoid burnout during residency, I will prioritize self-care by setting boundaries between work and personal time. Regular exercise, mindfulness practices, and maintaining a healthy diet will be essential components of my routine. I plan to foster a supportive network among peers, encouraging open conversations about stress and coping strategies. Engaging in hobbies outside of medicine will provide a necessary outlet for relaxation and creativity. Additionally, I will seek mentorship and guidance to navigate challenging situations, ensuring I remain resilient and focused on my passion for patient care. 15. Tell me about a mistake you made in patient care and how you rectified it. In my early clinical experience, I misinterpreted a lab result, leading to a delay in treatment for a patient. Realizing my error, I immediately informed my supervising physician and the healthcare team. Together, we reviewed the patient's case and expedited the necessary treatment. I took responsibility for my mistake by discussing it with the patient and their family, explaining the situation transparently. This experience reinforced the importance of double-checking results and seeking guidance when uncertain, ultimately improving my attention to detail in patient care. 16. What improvements would you like to see in our program? I believe that enhancing mentorship opportunities would greatly benefit residents. Pairing each resident with a dedicated mentor can foster professional development and provide personalized guidance throughout training. Additionally, incorporating more hands-on workshops and simulation-based learning can improve practical skills and confidence in clinical scenarios. Lastly, increasing the focus on wellness initiatives, such as mindfulness sessions or regular check-ins, can help mitigate burnout and promote a healthier work-life balance among residents. 17. How do you handle working under pressure? When faced with high-pressure situations, I prioritize maintaining a clear mind and focusing on the task at hand. I break down larger challenges into manageable components, allowing me to tackle them systematically. Time management is crucial. I set deadlines for each task to ensure I stay on track. Additionally, I find that clear communication with my team helps alleviate stress and fosters collaboration. Regular self-reflection is also part of my approach, as it enables me to learn from past experiences and continuously improve my ability to perform under pressure. 18. What are your intellectual pursuits outside of medicine? Outside of medicine, I engage deeply in literature and philosophy. Reading a diverse range of authors allows me to explore different perspectives and enhances my critical thinking skills. I particularly enjoy attending book clubs where discussions challenge my viewpoints and encourage me to articulate my thoughts clearly. Additionally, I practice creative writing, which fosters my ability to express complex ideas succinctly. I believe these intellectual pursuits not only enrich my life but also enhance my empathy and communication with patients and colleagues alike. 19. How do you build rapport with patients? Building rapport with patients involves active listening, demonstrating empathy, and creating a welcoming environment. I strive to understand their concerns by asking open-ended questions and giving them space to share their stories. Acknowledging their feelings and showing genuine interest helps to foster trust. Additionally, using clear and straightforward language ensures that patients feel comfortable discussing their health. I also respect their individuality by personalizing interactions and remembering details about their lives, which enhances the patient-provider relationship. 20. What do you think is the most pressing problem in medicine today? One of the most pressing problems in medicine today is the issue of healthcare access and equity. Many individuals, especially those from marginalized communities, face significant barriers to receiving quality care. These disparities can lead to poor health outcomes and increased morbidity. Addressing this challenge requires a multifaceted approach, including policy changes, community outreach, and education. By advocating for equitable healthcare systems and fostering relationships with underserved populations, we can work towards a more just and inclusive healthcare environment for all patients. 21. How do you stay updated on advancements in your field? Staying updated on advancements in my field involves a multifaceted approach. I regularly read peer-reviewed journals and attend conferences to absorb the latest research and clinical practices. I also engage in online courses and webinars that focus on emerging technologies and methodologies. Networking with colleagues and participating in professional organizations provide valuable insights and facilitate discussions about innovative approaches. Additionally, I follow thought leaders on social media platforms, which helps me stay informed about real-time developments and trends impacting my specialty. 22. Can you describe your approach to patient education? Patient education is a vital component of healthcare. I prioritize clear communication, tailoring information to each patient's level of understanding. I use visual aids and analogies to explain complex concepts, ensuring patients grasp their health conditions and treatment options. I encourage questions and actively listen to concerns, fostering an open dialogue. Additionally, I provide written materials for patients to review at home, reinforcing what we've discussed. My goal is to empower patients, enabling them to make informed decisions about their health and promoting adherence to treatment plans. 23. How do you ensure clear communication with members of the healthcare team? Clear communication with healthcare team members is vital for patient safety and effective care. I prioritize active listening, ensuring I fully understand the perspectives of my colleagues. I utilize structured communication tools, such as SBAR, situation, background, assessment, recommendation, to convey information clearly and concisely. Regular team meetings and interdisciplinary huddles foster an open environment where everyone feels comfortable sharing insights. I also encourage feedback to identify any misunderstandings quickly. Establishing a culture of respect and collaboration enhances our collective ability to provide optimal patient care. 24. What do you believe are the most important qualities for a resident in this specialty? A resident in this specialty must possess strong communication skills, as clear dialogue with patients and the healthcare team is essential for effective care. Empathy is crucial. Understanding patient perspectives fosters trust and enhances the therapeutic relationship. Additionally, resilience is important for managing the demands of residency. A commitment to lifelong learning ensures that residents remain updated on best practices and advancements in their field. Lastly, adaptability is vital, as clinical situations can change rapidly, requiring quick thinking and flexibility in approach. 25. How do you plan to contribute to our program's diversity, equity, and inclusion efforts? I plan to contribute to our program's diversity, equity, and inclusion efforts by actively engaging in initiatives that promote underrepresented voices in medicine. This includes participating in mentorship programs aimed at students from diverse backgrounds and advocating for inclusive practices within the curriculum. I will also work to create supportive spaces where all team members feel valued and heard. By collaborating with colleagues to organize workshops and discussions on cultural competency, I hope to foster an environment that celebrates diversity and enhances patient care. As you prepare for your residency interviews, having a solid grasp of common questions and effective responses can significantly boost your confidence. We hope this guide to the top 25 residency interview questions and answers has equipped you with valuable insights and strategies. Remember, preparation is key, but authenticity will set you apart. If you found this video helpful, please give it a like and subscribe for more content that can aid you in your medical journey. Good luck with your interviews, and remember to be yourself. Your passion and dedication will shine through.